Hi, today's case is a partially edentulous patient that is requesting information about dental implants. And what I wanted to tell you is that if you're looking forward to have implants on your posterior area where you already have lost your teeth, there's a solution: dental implants. Why is this important? Because one of the things that patients request is a solution with different things. The first one, it could be if we do or perform a bridge here. But what's the problem? That you will need to sacrifice these teeth. You need to shave them down and perform a 5-unit bridge. That could be one of the solutions. The other solution could be to have a partial, which we're gonna have teeth here, we're gonna have some type of clamps here, and you're gonna have teeth on the other side. Unfortunately, patients don't like them too much. Why is this? Because it's uncomfortable for the tongue. And this works, but it's old school. That's very important to understand. And then there's another one which patients need to be concerned. What do we see here is that we have receding bone. That's one of the most important things that happen here. And patients need to know what's going to be a long-term solution with this area if we don't act as soon as possible. That this bone should migrate down more. And we don't want that. We want it to be at least to stay like that. Now, there's another structure which we need to be concerned: the inferior alveolar nerve. What happens if the bone continues to go down? Well, there's not going to be bone on height and width. So at least we can still work with this. If there's enough width of the bone, we can certainly place implants here. We can place 1, we can place 2, we can place 3 implants there, or we can only place 2 in a bridge. This will depend on each patient's case. This is a more an accurate solution for this type of cases. And probably patients say, well, but my doctor doesn't want to place implants there. It will depend a lot on the type of bone and also on the width of the bone. But each doctor has different types of solutions. On this type of cases, the best way to go is this, because you can also preserve a little bit more the height of that bone. We don't want to lose more bone there. Even if you do bone grafting and different techniques that there are, like ridge splitting and all that, at the end, bone tends to come down and recede if you don't have that bone with that type of vibration, chewing vibration, and that strength. Bone is intended to be loaded. That's very important to understand. I'm Dr. Arzate, and this is another case of dental implants. I'm a diplomate of the American Board of Implantology. Thank you.